everybody. So today I thought we would talk about blood vessel inflammation. So yeah, happy Wednesday, and I hope you're all doing okay. I think we've got our thunderstorms, I think, should be over. We've been having some weird cloudy, rainy, thundery weather. So everybody in Austin, I hope we're kind of out of the worst of that storm activity that's happened. But yeah, today I thought we would kind of go into a little bit of the concept of what blood vessel inflammation is. What does it mean, and what do you do about it? And this is some exciting research that I'm kind of getting into because I kind of wanted to do a deep dive on some of these formulas that we use in different capacities for pain management, for cognition, and brain health. But then also we're going to see it in the cardiovascular patients who've got atherosclerosis, or even have a calcium score or any kind of plaquing developing in their blood vessels. So you back up and there's this concept of blood vessel inflammation that we kind of look into. And there's actually, I was kind of doing a deep dive here on the bioflavonoid rutin, R-U-T-I-N, and you're going to see this as a concept coming through a lot of these supplements. So what is it? What is it used for? How is it made? Why is it around? And what does it do? So I was just kind of researching that, and I thought I would share this with you. So today is just kind of a blood vessel inflammatory day. And I guess for people who are stumbling upon this, I'm Dr. Amy Nelson. I'm a naturopathic doctor. I practice here in Austin, Texas. You can go to my website and read all about me. But I do these little kind of things on Wednesday. It's like a Wellness Wednesday where we talk about any kind of concept or any type of new thing that I'm into, or I answer some questions, but it's a live. So if you come upon this and it's live, feel free to ask a question or participate. But most of the time people see this after the fact, and so then they just learn something. So I'm totally okay with that too. So yeah, let's talk about blood vessel inflammation. So we kind of mentioned this concept. I think this is a good visual aid. This is, oh gosh, I forget what university puts this out. I should look that up, but this isn't my work. This is basically a scale that talks about the calcium score. And what is a calcium score? Well, it's something that the cardiovascular doctor does for you to determine if you've got plaquing and inflammation in the blood vessels, and they're going to determine your risk factor for a stroke or a heart attack and the intervention that needs to happen. And sometimes that intervention is a bypass, or sometimes it's something serious that involves a surgery. So these are done to kind of evaluate that. A lot of cardiovascular doctors will use them even more so than the cholesterol levels to determine a risk factor for heart attack. I went to a really good talk once in my CE that, I have to go to continuing education events. And so we listened to a really good cardiovascular doctor who was really adamant about doing calcium scores on his patients. And usually a calcium score is going to be a CT. You get it done. You usually have to have a dye. And so then you're going to see, this is kind of the breakdown of the calcium score. So here we've got, you're going to try to see if there's these different lesions that are existing. So here, this is like, sorry if it's backwards, type 2 lesion. And you're going to see, this says here, a macrophage foam cell developing. So here we've got early stage inflammation. These macrophages are active, and they're starting to probably throw out some inflammatory cytokines, right? Why is that happening? Well, you've heard me harp about gluten and dairy and alcohol and sugar and and foods that are hard on us, inflammatory foods. The other thing too that we've talked about is hydrogenated oils, right? So Crisco, vegetable oil, corn oil, canola oil, the seed oils, these guys are oxidative. What does that mean? It means it bothers the capillary beds. Think of most of our vascular system is a capillary bed. Every end of an organ system is a capillary bed. Our cute little brains are capillary beds. Our sweet little kidneys are capillary beds. Our cardiac system, you know, our heart has a lot of capillary beds, right? At the end of every organ is a capillary bed. So the liver is a capillary bed. This, you know, the digestive system has a lot of capillary beds, right? So these are delicate. These are sweet and delicate. So if we've got a lot of inflammation going on, those sweet, delicate capillary beds really, really, really take a toll. Like they kind of have a problem going on there. So if there's a lot of inflammation going on, and we just mentioned the hydrogenated oils, oh boy, howdy. Yeah, talk about oxidative stress. Think of it as, you know, think of it as a wild cat running through your house, wrecking everything. Right? So it's like that. You've got these, this oxidative stress really destroys the tissues. It really is harmful for the capillary beds. What I find fascinating, your eye, right? You can look in, like when you learn how to do an eye exam, you know, go in with your scope and you can look in the back of somebody's eyes and see blood vessels live, right? And that's why when you look at, the eye doctor can look at lots of different pathologies. You can diagnose diabetes by looking at somebody's eyes. There's different characteristics that the vasculature will have in the back of the eye that will be indicative of atherosclerosis, hyperlipidemia, diabetes, right? Hypertension, right? So you can see all that blood vessel damage on the back of the eye. So I think an eye exam is so fascinating because when you look with your scope in somebody's eyes, you can see a lot of that. Now, it's hard to do in this day and age. You would actually, especially get a picture. So the eye doctor would usually have a special camera with a special picture, and they can take, you know, better analytics that way. So I find that very, very fascinating. So think about that when we've got these, the pathological findings of the blood vessels on the back of the eye are completely indicative of this type of inflammation that we're seeing. So again, here we start with that little macro, or the foam cell activity, the macrophage activity. Then here the next step is type 3, pre-atheroma, which is small pools of extracellular lipids. They're being deposited more and more in that cell wall. So that's the step right here, right? And then we go to this next step here, which is the type 4 atheroma, which is a core of extracellular lipids. So here we're starting to see like the plaques or the lipid deposition. And here you're just going on to have more of a stage of that within the vessels, right? So we've got problems in the blood vessels, and they're starting to develop this plaquing. Sometimes you can even develop a little hematoma in there. Sometimes it starts to fissure, meaning break apart. So you can start to see like, yes, we've got, you know, the precursors for a heart attack or a stroke happening here. So what can we do about this? We have to stop that inflammatory boulder from rolling down that hill, or we've got to figure out how to course correct, right? So of course you're going to change the diet. Absolutely. Does alcohol help any of this? No. Alcohol makes this, right? I always have that. My poor clients that come in, you know, we talk about alcohol all the time, and they're always sometimes kind of shocked when I'm like, stop drinking ever, like not a sip, right? And I present that idea because I know we as a society are used to our wine and our booze in some way, beer or whatever. Alcohol, ETOH, is hard on the liver. The liver hates it. The kidneys hate it. The pancreas hates it. The digestive system hates it, right? It's so much oxidative stress. And if we never say that out loud, if we never admit that, then we kind of live in this denial that we can be okay drinking a little bit here and there. If you have any of this activity going on in your body, no alcohol, you know, and you can do it. You'll be fine. You won't have a problem. The oxidative stress that's going on. So your worst thing would be I'm going to have some beer. I'm going to have some maybe fries that were fried in hydrogenated oil, right? I'm going to have some cheese. I'm going to have some gluten. I'm going to have some sugar, all that kind of stuff. Oh, and maybe I've got some MSG coming in. Maybe I've got all these kind of chemical type foods coming in, right? That is what really, really bugs this. That's what this system is really kind of responding to, right? So we always have to kind of take a step back and really be honest with ourselves about our diets. And me too, right? Like, I'm in this camp too. I'm not judging you. I'm judging me. No, I'm kidding. So what happens is I really want to break down, okay, what have I been eating? And it's okay to admit, right? And then now, okay, what do I have to maximize? Well, we're going to talk next about, okay, this is oxidative stress. So we want an antioxidant, too many words, antioxidant coming in, or we want a bioflavonoid coming in. We want something that brings with it the stabilization from this oxidative stress, this wild cat that's running through your house. We want it to come in and start cleaning up things and actually calming that system down. Where do you get that? Well, think about food as well. Anything with a color to it. So orange foods, the red foods, the blue foods, the green foods, you know, those foods have a very high bioflavonoid content to them of various varieties. That may be the one just general thing you need to know, right? And so let's say you have a Super Bowl Sunday and you ate that way. I just described the Super Bowl Sunday food. And so the next day, boy, howdy, are we going to do greens drinks? Are we going to eat salads? Are we going to have, you know, non-hydrogenated fats coming in? Maybe we're going to do avocado, and well, the guacamole was probably the healthiest thing at the Super Bowl. You know what I mean? So think about avocado is an omega-3 fatty acid. So we're going to be having these healthy foods coming in and stabilizing that system. And you probably have to have a lot more volume of it than you think you do, right? Because these other unhealthy foods, because they're yummy, they're easy to like mindlessly eat. When we kind of go into making concerted efforts for bringing in healthy foods, we often limit it because, of course, it doesn't taste as yummy as these other things, right? So I would say, you know, have a dinner plate of salad, you know, having these greens drinks, having, you know, different carrot juice, you know, stuff like that coming in is a really healthy idea, right? So that said, what can we do and what have been studied to help reduce the blood vessel inflammation? You might have seen this guy. This is Nepronol. Okay, so Nepronol is kind of a very, very interesting formula. This guy came on the market, oh gosh, maybe 5 years ago, but you know, it's been kind of mostly popular in the last 5 or maybe 2 years. So here you're going to see serrapeptase and nattokinase. So these are enzymes, right? And these are what we call proteolytic enzymes. What does that mean? Well, by the time we're cooking one of these, we've got cytokines, which are chemical messengers that cause inflammation and end up with this type of damage. You know, there's many, many, many kinds of them. And research studies these because how do you stop them? How do you balance them? So that brings in what we call the proteolytic enzymes. That means I'm going to break down these inflammatory cytokines in some way. And serrapeptase and nattokinase, the other one is lumbrokinase. They are studied a lot with reducing this type of inflammation that happens in these blood vessels. You're also going to see them in blood clot studies all the time. So that same cytokine signaling also signals up the activity that creates the fibrin that develops into our little blood clot. So here's, even in this last stage of this type 6, you would see this kind of hematoma blood clot potential starting, right? So that gets the ball rolling for all of the biochemistry with creating the fibrin that creates the blood clot. So when we are trying to reverse that, yeah, you might see a lot of these proteolytic enzymes. Nattokinase, serrapeptase, and lumbrokinase are the top 3. You have to take them away from food. Yes, you have to take them away from food. That's the hardest part about these enzymes, is away from food. What does that mean? Well, it typically takes 20 minutes for something to empty out of the stomach. So if I ate a meal, get it, and make sure, if you're a little constipated, maybe it's a little longer, maybe it's 30 minutes, but 20 to 30 minutes your stomach should be empty. then you can take the enzyme and it can be absorbed without being inhibited by food. So that's the most annoying part of taking these. Also, if I just took it, let it be, give it its 20 minutes in the stomach, so don't eat anything right after it. So it's got to be at least 20 minutes away from something. You'll see that time frame vary. So sometimes it'll be like 45 minutes, whatever. That's just somebody's taking the liberty to expand upon that. I mean, empty stomach typically means 20 minutes, right? So unless you've got some stomach emptying problem, which the diabetics usually start having problems like that. So, I mean, there's a lot of reasons somebody would have a delayed gastric emptying. And so if they have that, they usually know, because there's a lot more discomfort and stuff like that. You're probably not that's not usual. So usually the 20 minutes is in there. Now you're going to see these other, like, there might be other blends in here. So here in this formula itself, we've got, there's a little enzyme formula, and the two main things I want to talk about are, of course, bromelain, rutin, and then you guys know I love quercetin. So quercetin, we've talked about it before. I love that quercetin dihydrate. These guys are all enzymes. So bromelain, quercetin, and rutin are all enzymes that you're going to find in plants. The famous bromelain is going to be pineapple. Quercetin is going to be apple. Rutin is found in lots of different plants. In fact, I have a little, this is what I was reading prior, was information about rutin and what it is. And it looks like it's actually the quercetin molecule that's in combination with this other, it's called O-rutinose. So there's a different molecular structure. It's like quercetin, but different, and rutin itself is also a plant pigment. So these guys are different than the proteolytic enzymes. These are a different kind of active, they're active in foods, they're active in, fruits and stuff and vegetables. And so what they are also going to do is reduce inflammation. They're going to be proteolytic in lots of ways. So here, rutin especially, I was looking at it, and there have been studies in which you would take between 500 and 600 milligrams a day. And so, oh, hi, I just got a heart from somebody. Hey, everybody. Oh, good, I'm not talking to myself. Good, there's people. Good to see you all. Yes, so we're talking about the second phase of Nepronol. So Nepronol, we talked about the proteolytic enzymes, and now we're getting into bromelain, quercetin, and rutin. And, Nepronol is going to talk about advanced fibrin defense. That's it's a blood clot kind of formula and is used therapeutically in that way. And then the other one I'm going to bring to the table is this guy, Vascuzyme. I was looking into its little formula. So this is by Orthomolecular. They're kind of in the same concept, but they just have some different enzymes in here. So they've got trypsin, chirotrypsin, bromelain, pepsidase, quercetin dihydrate, and rutin. So they're like similar formulas, but using different enzymes. And why does this matter? Because this is how you would counter that inflammatory process that's bothering your blood vessels, right? So we're bringing in lots of bioflavonoids. Let's say you're eating a ton of different green leafies and your vegetables. Now, these are things that we use therapeutically to kind of improve that blood vessel inflammation, okay? Now, rutin, this article is... Where is this article from? Experimental Journal of Clinical Health, Clinical Studies. So it just really is a deep dive into what rutin is. And here's its little enzyme formula. So here, what we have is a, like we're saying, a quercetin molecule. And then here we've got this other rutinose, which probably is some type of sugar. Here's its, recap. So rutin has been classified as a blood vessel protector. In studies, they're going to, talk about that. Reduces capillary fragility. It's used in formulas for varicose veins, right? Used in combination with bromelain and trypsin. And here, the actual milligram dose that I found in the one study was like 100 milligrams of rutin, 50 milligrams of trypsin, and then 90 milligrams of bromelain taken 3 times a day to reduce this blood vessel inflammation. It's an antioxidant. It's a free radical scavenger. It helps with the cytotoxicity of LDL. So let's talk about that for a second. You've got your high density lipoprotein, you've got your low density lipoproteins in your blood, right? And so you've got the bad cholesterol and the good cholesterol. Why is the bad cholesterol bad? Because of its low density. So it's got a lot of oxidative stress on things. It can, and then you've got maybe even the VLDL and those lipoproteins, right? So they are what kind of drive a lot of this type of inflammation, right? So how do you stop them? How do you help them? Niacin is one thing. So niacin itself was a way to restructure the LDL molecule. So it changes its, oxidative problem, right? And so it, think of it as making the molecule fluffier, instead of having this like acute damage from the LDL on the blood vessels. The other is the other is, reducing the cytotoxicity. What we're going to do is help, improve the LDL numbers. So when you get a cholesterol panel, you might see really high LDL, and then you might see the non-HDL numbers. That gets you concerned that maybe there's some oxidative stress going on with the blood vessels. So what you want to do is at that point understand where the inflammation is coming from. So you will put somebody on an anti-inflammatory diet, and then you might go ahead and try some of these out. The other things on the blood test that you'll look at is a high sensitivity C-reactive protein. You look at the homocysteine. You could look up like fibrinogen, plasminogen. So these are all blood vessel inflammatory markers that you could have run in addition to the cholesterol markers. So here, rutin helps the cytotoxicity of LDL. So that would also be part of the therapy that you would do. So that's kind of really the gist of what I've been looking into today. We might talk a little bit more about rutin as I get through this article and get through kind of studying these different formulas. But yeah, if you have any questions, just, message me. It takes me a long time to get through the Facebook messages, and sometimes I have somebody help me do that. But next week we can kind of continue our discussion about blood vessel inflammation and how it impacts things. Like we're seeing it in a couple different areas, of course, with with issues that may be going on with cognition or early stage dementia. You're going to think about blood vessel inflammation in that aspect. You're going to think about blood vessel inflammation in the cardiovascular patient. You're going to think about blood vessel inflammation anywhere someone's got issues, like your kidney patient probably has a high degree of blood vessel inflammation, because remember, the kidneys are just these delicate capillary beds. So you really address it in lots of different areas. Your best first step is to reduce the inflammation coming from the diet. Remember, all nutrition, we don't care about how much fat and carbs and protein it has. Is it inflammatory? Is that food inflammatory? We don't eat it if it's inflammatory. Then yes, we can consider the carbohydrate and the fat and the protein sources and things like that, and the metabolics of food. But you really always want to consider food from an inflammatory perspective first. Okay, so all right, everybody, I have to get back to work. So it was nice chit-chatting with y'all, and have a great day.